Today we will be looking at main points of advisory issued by National Institute of Health Islamabad about Nipah virus. Nipah virus is a zoonosis. It means this disease is transmitted by animals to humans, and this disease infects animals as well as humans. Virus is endemic to Southeast Asia, means originated in Southeast Asia. Nipah virus was initially isolated in Malaysia in 1999, mainly among the people in close contact with pig. An outbreak of Nipah virus with 6 confirmed cases and 2 deaths has been reported in state of Kerala in India. Affects wide range of animals and causes severe disease and death in people and is a public health concern. If we talk about the biological classification of the virus, it belongs to family Paramyxoviridae and genus is Nipah virus. Next is how it is transmitted or transmission of the disease. It is bat-borne disease. It means it originates in bats and then it is transferred to animals and from animals to humans. It can also be transmitted by contaminated food, the food which is contaminated by saliva, urine and excreta of infected animals. It can also be directly transmitted from people to people, person to person. Infected persons can transmit it to healthy people. Incubation period of this virus is 5 to 14 days. Symptoms of the disease include fever and headache, muscle pain, nausea and vomiting, drowsiness, disorientation and mental confusion. These symptoms remain for 3 to 14 days. There are different types of cases if we talk about Nipah virus. Suspected cases in case of Nipah virus are those which persons have following symptoms. They have fever and they have respiratory features like cough, breathing difficulties, encephalitis symptoms and onset of fever, altered mental status, seizures or any other neurological defects or deficits. Next type of suspected cases fall in if they have epidemiological link, ingesting raw data or palm sap or travel with Nipah virus endemic areas where the disease is present. The next category is of probable case. Probable case is any suspected case with epidemiological link or positive serological testing. The third category is confirmed cases. The third category is of confirmed cases, any suspected or probable case with laboratory confirmation. The case which is confirmed in the lab is confirmed case. Now for testing we have to use PCR, serological testing, and for PCR we have to get samples from throat, nasal swabs, cerebrospinal fluid, urine and blood. And for serology we need at least 5 milliliter of serum for serological testing. Tissues and samples that we have obtained should be fixed in 10% buffered formalin for 48 hours prior to histological processing. If you talk about treatment, there are no specific vaccines or antiviral medicines available about the treatment of this virus. We can only manage the symptoms and manage the fever of the patients. Supportive care is recommended as no specific antiviral is available. Treatment is mostly focused on managing fever and neurological symptoms. Severe is uncertain. Currently, no NIV vaccine is approved either for humans or animals. The present options to prevent secondary transmissions, or we can say that preventive measures, are active case finding, contact tracing, isolation, quarantine of cases and their contacts, community awareness regarding consumption of fruits, and ingestion of partly consumed